crisis facing our rural doctors today is burnout, stress, and the fact that there are not enough rural doctors to provide the support that our rural communities need.
If we started losing our healthcare practitioners, it's a domino effect. It affects everything.
If we were to lose our doctors and health practitioners here, I don't see a way of being able to stay here with my family. We need consistent access to healthcare facilities.
To encourage people to live here and age here and to raise families here, people do rely on that security in healthcare.
Our doctors have some health problems or health issues like any ordinary people. It's important to have them cared for within their community, because if they leave, then they don't see that continuity of care for those patients, especially the aged patients who become very stayed in their ways.
As doctors, we are vulnerable ourselves. We're not immune to diseases and things. And it just takes our time and away from community when we have to travel for, where we are, it's 7-9 hours from the city. So that's not viable.
Trying to get into a doctor is sometimes very tricky, so if you have to take a doctor away from their workplace for a full day of travel, another day to do their appointments and then a day travel back, that's 3 days that you've lost a doctor for. So that's potentially, 15, 30 odd people that have to wait.
And that's where the Rural Doctors Foundation GPs4RuraDocs program really fits in, is that we're aiming to keep those doctors well and supported and in those communities seeing patients where they're actually really needed.
Doctors need trusted, confidential and available healthcare. And so what our scheme does is bring skilled GPs to see doctors in their own community and other health professionals who need this as well.
That program helps support these healthcare professionals, whether you're a doctor, a nurse, an allied health professional, to access care also close to home, but not by a friend or a work colleague, by someone with a little bit of independence and that you can have trust in that person, people with lots of experience in the rural context as well.
When we do clinics for the program, what we're doing is general practice care in a general practice environment, taking time to listen to their problems, their current issues, create a long-term healthcare management plan for them. It's very similar to the general practice that I did for many years, but because it doesn't have necessarily the same time pressure, we're able to provide a much deeper level of care for our colleague patients.
I was very excited when I learnt about the Rural Doctors Foundation initiative, and being able to see a GP with such a knowledge of rural health and also obstetrics, that's also a very great benefit out here.
I see this as a really great opportunity for all the healthcare providers that are working in these small communities to access a discreet confidential service that's planning to come back on a semi-regular basis that you can develop a really good rapport with, and it just gives you that accessibility, and you feel confident about what that's going to provide going forward for you.
It can be quite worrying, even for myself, having my records here. If I come in for a blood test, my colleagues are going to know that I'm pregnant. I might not want to tell them when I'm 6 weeks. So, be able to see someone who's an outsider, they can take my pathology away, they can get it tested, and it's all private. It's not, in our chart room or, on our system. It's also fabulous that we don't have to wait for them to come out. We can always contact them if we would like a telehealth appointment.
It's in the interests of the rural communities. Ultimately, having health professionals who are staying and looking after them and being well enough to do so is the way to look after rural communities. And from a bigger perspective, this helps retention. So if you can keep doctors happy and well, and their families happy and well, and if they can get the care they need, it's one more thing that helps them stay in the community.
Having the GP come out is a huge difference. So previously my GP was in Roma, so that's a 6-hour round trip. It's just really important to sustainability to be looking after ourselves and our staff. At the end of the day, if I'm not looking after myself, I'm going to get burnt out.
This
basically provides us the ability to stay here and service the community and to be healthy ourselves.
It's made a huge difference to a couple of staff that I already know about in the short time that we've had the service, and it's possibly been life-saving in one of those cases.